For a country with such high income per capita, the services for people with disabilities are quite limited. What we have in Trinidad and Tobago is a large number of people that in other countries may be on disability, but here are entering into the workforce. So you may have someone who is hearing voices or cannot grasp reality, and they're working in a factory setting with very hot items or very sharp tools. Or you may have a victim of domestic violence who is ashamed and hiding what she's experiencing. So she's experiencing depression and anxiety, and that's impacting her capacity to work with her coworkers, to solve problems, to concentrate, and she's making lots and lots of mistakes. Or she may have very high absenteeism. She doesn't come to work a lot. She's always making excuses. And though her workplace may see her as negligent or absent, she really is someone with unaddressed depression and anxiety, or someone who feels generally unsafe and doesn't know how to access those things. Well, the first thing that's really important for a safe space is destigmatizing mental illness and to reframe that in thinking about mental wellness. So if mental wellness is talked about from the top down, from leadership all the way through the organization, that can begin that process where someone would feel comfortable saying, my mental wellness is being affected and it's affecting my work. Just like someone would say, I have cancer and it's hard for me to work. Someone should be able to say, I think I have a substance use issue and it's affecting my capacity to work. Employee assistance programs are an excellent way to provide a layer of privacy and easy access to care. In Trinidad and Tobago, we don't have clear laws on privacy in healthcare. So creating some sense of privacy will help people to get access to care. And what EAP programs do, or employee assistance programs do, is allow that employee to call the EAP and say, hey, I'm having a problem at home, and get the support that they need without having fear that it's going to go back to their administrators. Well, one of the things they can start with is by asking their employees, how are you doing? That can be a small focus group where you find out what are the issues and concerns that your employees face from day to day, or it could be an actual survey or study where you find out what is the wellness of your workforce. That can also be looking at just the insurance claims. So that can give you a clue into what your workforce is experiencing. If you have an existing employee assistance program, you can ask that employee assistance program for the data. What have our employees been coming in for? So after you ask, you can partner with an employee assistance program to do a better assessment and identify what kind of program would help not only treat what's happening in your workplace, but prevent problems from becoming bigger. Sure, every workplace should have a harassment policy, a discrimination policy. Every workplace should have very clear access to mental health services where people can anonymously request the services. Unfortunately, there are a lot of workplaces where if you want to access the EAP, you have to go to HR and tell them what your problem is first. And that's a really good reason not to go. So there needs to be a very clear policy for how that organization implements EAP services. In many cases, workforces can develop kind of committees that are interdisciplinary, with someone in security, with someone in facilities, with someone in HR, with someone from the EAP, or someone from the union, or various aspects of the organization to work together and say, what is it about our organization that makes it feel psychologically safe or unsafe? And what policies can we recommend to change that? I want to couch, when we think about gender equality in terms of the UN goals, by acknowledging the tremendous progress and advancements that Trinidad and Tobago has made. There's a female president that has been elected. There are women throughout the judiciary system that are making decisions. There are thousands of small businesses that are led by women. Women are making a lot of decisions in this society. And when you look at the Caribbean, Trinidad and Tobago is really leading in terms of that. But there is a lot of room for improvement, and it plays itself out in the workplace. So for example, right now in Trinidad and Tobago, young people who may not be in a traditional relationship will have a very hard time getting access to reproductive health care, whether that be access to condoms, access to pre-exposure prophylaxis to prevent HIV and AIDS, whether it be, imagine having that on your health form and that going to HR, the amount of stigma that someone would experience. Women don't have access to adequate health care for their reproductive health to prevent infant mortality or prevent themselves from experiencing postpartum depression. When we think about gender equity, policies about pay are still not transparent. And all of that stress can increase your risk to mental health issues. Currently, when we think about sexual harassment, if it is not okay to say that my boss has made me feel unsafe, then there's not an outlet to address that. That person is going to experience mental health problems that will impact their functioning. So the workforce is where we spend most of our lives. Whether we like our coworkers or not, we spend more time with them than we spend with our spouse. So if the workplace isn't addressing gender equity, the society is not addressing gender equity. Currently in Trinidad and Tobago, in the public system, there's a separate day for you to come in and receive treatment for your mental health care. I just want to sit with that for a moment and think about the implications of that. Most people who experience thoughts of suicide are more likely to tell their medical doctor about it than to tell a therapist and counselor. What kind of message are we telling people about taking care of their mental wellness if in their medical setting, mental wellness is not being discussed and addressed? Internationally, if you look at any chronic illness, how you feel impacts whether or not your treatment is effective. So if you're HIV positive, if you have depression or anxiety, you're less likely to be able to take your medication consistently, which means you're most likely to have complicated medical issues and die of that illness. But you don't have to if you're mentally well. You're usually more capable of following up on your care and having a normal lifespan. If you have diabetes and you have depression, you're less likely to adhere to your proper diet and to your proper medication. If you move a little bit farther back, if you have anxiety and depression, you're less likely to make healthy food choices. So you're at a higher risk for getting diabetes. And when you have diabetes, it's harder for you to control your illness. So that is why you see with many medical conditions that anxiety and depression affect the outcome. It's not a direct effect on the illness, but it's a direct effect on how we manage the illness. If the workforce functioned the way our limes do, or our parties do, we'd see a major change. When you go to an event at Carnival in Trinidad and Tobago, the unity, the coordination, the looking out for each other. I don't walk into a party in Trinidad and someone doesn't offer me a drink or make sure that I'm comfortable or make sure that I'm having a good time. They will bend any rule necessary and think it through to make sure that I left out of there saying that was the best fete of the year. But I went to a fast food restaurant the other day and said I'd like a small soup They said, "We are out of the cups for the small soup, so you can only buy a large." I said, "May I have a small portion in the large cup?" "No, you may not. That is not the rules." That is not the rule. That is not the way we do it. That rigidity comes across to people as lack of compassion and caring. That's lack of communication, and that's why our coworkers cannot help us get the support that we need. So it starts with giving to each other and coping with our stress by giving to each other and listening to each other and paying attention to each other. So if the rule is you can only have 6 missed days from work, instead of just saying it's time to terminate this employee, they've missed too many days, begin to ask, why is she missing so many days? How can we help this employee to take care of the personal issue that's affecting her performance? Employee assistance can help you to do that, but also individuals and organizations can help even more. Trinidad and Tobago actually, for the size of its country, utilizes employee assistance services tremendously. It's something to be really proud of. What I would like to see is smaller organizations utilizing those services as well. And I'd like to see those organizations that do utilize the services, utilizing them more effectively, not just for the emergency, but for prevention. I received a call today about a distressed employee that really needed to go to the emergency room, and it didn't happen because there had to be multiple steps of approval. There is an EAP, but the EAP is not being used effectively because of rigidity in thinking and lack of compassion. So let's take it another level. Let's replicate the models that are working well throughout Trinidad and Tobago, and let's connect with the rest of the Caribbean and see how those models can work in those settings as well.
Thank you for joining us for this episode of Building Sustainable Minds, and stay tuned for more insights from other leaders in the field of mental health from Trinidad and Tobago.